Hello, differential diagnosis team. This is Dr. Kamel again, and I'm coming to you with a new question today of the NBT style question series, which we have started with the first question. I don't know if you have seen the first question or no, but this is our second question of this series. So let's go and see. Our today's question says, as part of the medical history, a 23-year-old female patient reports a sudden onset of pain. Which medical condition is most consistent with this clinical presentation? Is it bicipital tendonitis? Is it hamstring strain? Is it Osgood-Schlatter disease? Is it peripheral vascular disease? Okay. So we have three cases which are orthopedic related, and one case is which is related to circulation, cardiovascular, or whatever you want to say. You know, patient interview provides us as a physical therapist with an opportunity to identify specific characteristics of pain. And as I have told you in our first lecture, we need to listen to the patient. We need to listen to what the patient is saying. So pain is a subjective phenomenon, as you know, and the subjective data which the patient informs you about give you valuable information related to the patient's medical condition. We need to know what is the location of pain, what is the intensity of pain, what is the description of pain, what is the duration of pain, what is the pattern of pain, how the pain started, how long it has been there, and so on. Depending on that situation, depending on our knowledge of pathology, we can determine if this case is what of the following options. So what is the correct option, you think? Let's describe each one. Let's take option one, bicipital tendonitis. What is bicipital tendonitis? Bicipital tendonitis is an inflammatory process of the tendon of the long head of biceps brachii in the upper extremity, as you know. This condition is characterized by what? By subjective reports of a deep aching pain. What is the location? Directly in front and on the top of shoulder. What makes pain worse? Pain is worse with overhead activities or with lifting. Okay, and pain tends to come on gradually over time. So this is a pattern and can be heavily influenced by activity. Do you think that this is a correct answer? I don't think. From the description of this question, sudden onset of pain, and so I don't think this is a correct answer, but we will know. Let's talk about hamstring strain. Hamstring muscle itself on the back of the thigh consists of semimembranosus, semitendinosus, biceps femoris muscles. Okay, this is the anatomy for the hamstring. Hamstring strain is typically caused by muscle overload that happens when one or more of the muscles is stretched beyond its capacity or being challenged with a sudden load. Okay, pain varies based on the severity of that injury, but it is usually described as a sudden sharp pain in the back of the thigh. This could be the answer, maybe, we will see. Osgood-Schlatter disease. Osgood-Schlatter disease, also known as traction apophysitis, is a self-limiting condition usually, which goes away without treatment much. That results from what? From repetitive traction on the tibia tuberosity apophysis. There is repetitive tension on the patellar tendon and commonly occurs in young athletes. 23 could be young, or maybe in teenager or as an adolescent. I don't know. Pain often occurs in the form of point tenderness over the patellar tendon at the insertion of the tibial tubercle. Okay, and pain tends to be more on gradually and is typically made worse with increasing activity. I don't think from the description of the pain in this question that we are dealing with Osgood-Schlatter disease, but we will see. Option 4, peripheral vascular disease. It is a condition where there is narrowing of the lumen of the blood vessels. Caused by what? By a reduction in circulation or blood supply, usually secondary to atherosclerosis. The symptoms will differ depending on which blood vessel has been compromised or has been affected. During the early stages of peripheral vascular disease, there will be intermittent claudication, which could be the only manifestation the patient will complain about. What is intermittent claudication? When the patient is doing activity like walking or like ambulation, patient starts to complain about gradual increasing in pain and muscle spasm. Why? Because as we increase the activity, there is more demand for blood flow, and this is not happening. So there will be some sort of ischemia, and this will result in pain and muscle spasm, which will increase gradually and will improve by rest. Then in later stages of peripheral vascular disease, the patient may experience tingling and numbness of the affected extremities, along with pain at rest and during sleep. So from the 4 options, sudden pain and so on, I think and I'm sure that what is the answer? The answer for this question is number 2. This is a hamstring strain. So again, hamstring strain is caused by muscle overload, or the muscles is being stretched beyond its capacity or challenged by sudden load, and pain usually will vary in or varies in intensity depending on the severity of injury, but the patient will describe the pain as sudden sharp pain in the back of the thigh. So this is the correct answer. So you need to listen more to the patient when you are taking the history. You need to be more careful about what you are listening, how you collect data from patient, and at the same time you need to be aware of the different pathology and the underlying mechanism for different injuries. Thank you so much, and I will see you soon in a new question.